Ready? Here we are. It's the Genesee County Compassion Club show. It's coming to you live from allpointstv.com. What's up, everybody? It is February. It is freezing, and we got more snow coming. So, what's up?
How much did you expect? How much did you hear that we're supposed to be expecting?
All I know is I heard the temperatures, and like nothing above 20. Maybe Friday it might go above 20, but everything else is below that.
Well, I can't really complain, although I do because I enjoy it. But we can't really complain. This winter's been fairly mild compared to the last year.
Yep. That's John, the man behind the cam. If you're wondering who's speaking, he's the man who puts it all together here at All Points TV. John, I'm amazed at your shoveling capacity. You're just this dude's got a driveway and a half, and he makes sure it's spotless. It's amazing.
Well,
you're a testament to backbreaking work there.
Luckily, I did have an assist last time when I started with all the heavy snow. A guy was going by with a plow, one of the neighbors and relatives, and he plowed it all the way back to me. It's like I'm going to give credit where credit's due, but normally I do it all the time. Also Chris, who lives here, he does a lot of the shoveling too.
Yeah, modest. John is so modest. All right, everybody. Hey, we got some medical marijuana news. We're going to let you know what's happening at the Genesee County Compassion Club. It's been rocking down there. I know we're well over 13,000 members. Last month was amazing. Just got done reviewing the reports, and I think we had like over 800 renewals in 1 month. That's just mind-blowing in January. So you guys rock down there. It's absolutely amazing. Staff is kicking it, and man, I love the club. So, but as far as events go, we're laying low right now. It's cold out. We're just making it happen, trying to stay warm. But we do have the soup kitchen. I don't want to let you guys forget about that. That is the last Friday here in February. So mark your calendars. Always looking for volunteers. And Matt Bernash is kicking booty down there. And any help that he can get is always appreciated. So definitely would like to have you guys there for that. So other than that, we got our 420 party coming up in April. Keep your fingers crossed for warm weather on April 20th. I know it's been hit and miss. Last year was absolutely beautiful. This year, hopefully, we'll have the same. Just keep your fingers crossed. All right, I know we got the monthly meeting coming up. You guys ready for that? So any suggestions you have for the 420 party, let's get them out there so we know what you want. We definitely want to hear from you. And I think that's tomorrow. So come up to the club at the Ed Center, 11 o'clock. You guys can make your voice heard, and we'll get it on. Or did that already go by? No, we're good. I had to check my calendar. Hey. We got some information here. Sean is kicking it over at the lab. You guys have been submitting your samples for testing. And last week, we had some awesome results I want to share with you. So our caregiver of the week last week was Kiwi with the Alien OG. It just stomped it. Let me look at the numbers here. Sean texted them to me. It's 24.27 was the total. That's just outstanding. I mean, that's high of the high. 24.27. Had 23.28 THC, 0.12 CBD, 0.17 CBC, 0.48 CBG, and 0.22 CBN. Yes, we do, in fact, test for all of those different cannabinoids. And we're looking to be adding on some more testing in the future, maybe some terpene profiles, figure out why that Alien OG tastes so good. But it is definitely potent stuff. So, Kiwi, you rocked it. You nailed it. And, man, 24 plus. That's huge. Those are huge numbers. Our caregivers at the Compassion Club, you guys just deliver quality over and over again. It's awesome. I'm so glad to have a variety and so glad to have that level of quality. It's awesome. You open up a High Times and you got, stuff in there. It doesn't even compare. We got it. We got them. All right, let me grab some news here. What's going on in the world? Not a whole lot. Obviously, there's a reset going on with the Michigan State Legislature. The bills that they had going on previously, they've died. Lame duck, couldn't get it through. Quack, quack, crash. And so now we're basically restarting. There's a lot of different groups out there. You've got Michigan Normal, Safer Mich. There's a couple different groups out there. I think there's Moms for Cannabis United. I get the names mixed up. So a lot of different smaller grassroots activist groups. You got bigger heads in the mix as far as lobbying goes, of course. We talked about the Prairie Plant Systems up there, the Canadian company that wants to take away your rights, basically. There's other guys out there that are in the same line of thinking. There's been some vineyards in the past that have popped up, some nurseries around Michigan certainly have the capacity, would like to step in and grab a hold. But right now, it's a clean slate in a sense. I mean, you've got a fresh batch of legislators up there at the House and in the Senate. So it's an opportunity to go and have a new relationship, also a time to continue an old one if you didn't have a change up, and really sort of clear the air. Hey, these bills are passed, don't even need to bring them up. And so what's the expectation level now? What do voters want to see? What is the general population looking forward to when it comes to marijuana here in Michigan? Do we want to see a more regulated system, something more clearer defined, as they say in the paper, when it comes to the Michigan medical marijuana law? Or are we looking forward to something more along the lines of a decriminalization or a full-out legalization effort? All of these are the questions that everybody is really talking about. And that's really, I think, one of the big changes that we're seeing, or that we have seen in the past 5-6 years, now that we've had medical marijuana, is that everybody's talking about it. It's not something that's a backdoor issue anymore. It's not going to be swept under the rug. It's a front page news item, and it's a hot button ticket that some people want to jump on, to the left or to the right, whatever it may be. But it's something that people want to get invested in and engaged in. And so at least we have, open ears, if anything else. So it could be a positive thing, but also I think a lot more people are knocking at the door now, whereas before it was just a few little fledgling efforts. But at any rate, it's an open playing field. And so, if you have some views on, where you'd like to see things go in the future here in Michigan, whether you want to see just straight up legalization, regulated use for adults, that sort of thing, taxation, all that good stuff, maybe not. Or if you just want to see, something more regulated for the patient caregiver system, whatever it is you're looking for. Now is the time to get in there and actually put in your ideas. They might actually have some weight. They might be able to be used in the foundation of what may be future legislation. Because right now, that's when they're taking in the ideas. So I'd encourage you to make a phone call. These guys are, like I said, fresh back in office here at the state legislature. And they're looking to hear from their constituents. They want to hear it. It's kind of like, oh, good, somebody's calling me. Someone cares. Well, you could be that person. Give them that voice. Let them know what they're supposed to be doing. They're your employees. They work for you. Don't forget that. Be polite, but let them know what it is you want to see them do. And that's what they're there for. And it only takes a few minutes too. So try to do that if you can. Let me grab my tablet here. I had to plug it in. I think the cold weather just zaps batteries. Yeah, look, it already wants to die. It's like, plug me in. I'm going to puke. This is kind of interesting. A little story I want to share with you guys this week. Some of you may have heard about the omnibus bill. That's the spending package bill that's going through on the federal level. Basically decides, where they're going to use money at. And you also heard that part of that bill was excluding future efforts at going after states that have medical marijuana or recreational marijuana and prosecuting cases there. So they're basically taking away the funding that would go to facilitate that effort, and in a sense, sort of already encouraging what's really the public sentiment is ahead of, which is, hey, we're done with marijuana, let's focus on hard crimes, real crimes, and so on. So at any rate, that's a reflection in the budget that we saw there. Now, as that is being passed and going through, and it takes a while for these changes to actually happen. Nothing happens overnight when it comes to the government, of course. But in the meanwhile, we still have cases that are going on. And one of the biggest cases that is in the country, and I think really, this case should have a lot more press than it does. But the Huffington Post did cover it. So thanks to them, we do have some information. But at any rate, this is involving Harborside Collective out in Oakland, California. They're one of the largest medical marijuana collectives in the state. One of the first ones really to get going out there. You guys have probably heard about them. They had a show on TV for a little bit, ended up getting canceled over some type of lawsuit baloney. But at any rate, this is the guy, Stephen D'Angelo. He's one of the first people to have testing in his center. Really just a pioneer in the industry. And he is currently, still in a court case with a federal attorney by the name of Haig. It's kind of interesting. But at any rate, this attorney is still going after them and trying to pursue that they were not following state law and trying to treat them as a federal criminal. Now, mind you, when they go after these cases, it's not like there's a speeding ticket for having too much medical marijuana or having too many patients as you might think, out there in California. They go after them as full-on criminals. So they take away the medical exceptions that they might have had under state law and basically say, these guys were manufacturing and maintaining drug facilities and had a cartel going and so on and so forth. But at any rate, that's where the case is at. It still hasn't been decided. It's going to the Ninth Circuit Court of Appeals and being argued there. This is a big business. It's a $25 million a year business that they're going after. And like I said, Stephen D'Angelo and the Harborside Health Clinic have really been pioneers in the medical marijuana. They were around long before Colorado and Washington and Alaska all became legal for recreational use. And, they really were the people that were pursuing this on a medicinal level. Like I said, they're also involved in one of the first testing facilities for medicinal cannabis that I ever heard about, and that was back in 2010. So, I think that the pursuit of this group is just really, it goes to show how we have this sort of two-handed government going on. The left hand says one thing and the right hand goes and does another. And, like I said, the omnibus package, that's one thing, dealing with spending and appropriations. Obviously, it's going to take some time to kick in and have an effect on these departments. But, is this really a proper use of our resources here? Is this proper allocation of what we should be spending our funds on a federal level, going after a group like this that's clearly following state law and working on a medicinal level and helping patients? Excuse me, I got a scratch in my throat. One of the things I'll point out to sort of emphasize that is that the local officials there in Oakland County said, hey, closing this business would be a detriment to the community. So when you've got the township officials stepping up and saying, we like this group. They've been here for a while. They're a positive influence. They're making an impact in a good way. We want them here. And then on the other hand, we've got the federal government trying to treat them as criminals. On top of this case, if you dig a little bit further, they're also being pursued on a federal level from the IRS. So they're going after them for trying to write off business expenses such as like paying employees and paying for product and so on and so forth, which that ultimately would close the business as well. So they're getting the double whammy out there for being the leader in the industry, for being one of the originators, and really taking this, with a lot of chutzpah, as John would say. I mean, Stephen D'Angelo and his brothers out there, the group, the people that work at the Harborside Health Center, they're going to work every day trying to help people out. In the meantime, being treated as a criminal, and being prosecuted as one. Facing prison time, huge penalties.
What I think is ironic too. People like them actually try to do everything they comply to make sure the laws are there, and then they follow the law. The people who are enforcing the law are acting like the criminals, but they're trying to find anything they can to, they basically just want to get the money. That's all it is. These politicians, this is about money.
Yeah.
They just want to drain them financially, and that's what I think is more appalling.
Well, Mr. D'Angelo says he has no intention of closing his doors. He's going to continue to press on while he's fighting this federal court case. Well, actually, both of them. So kudos to you, Stephen. Keep it up. And, hopefully we can have some good sense come out of this. Hopefully the appeals court can see the nonsense and the oxymoron of what's going on here. I mean, clearly we've got state law being followed and a trump of that federal law come in and say, no, we want this. I mean, it's a money grab, John. You're absolutely right. But at any rate, let's see where that goes. We'll keep you updated as to the court case. I think it's going to be a big one. I think it probably will be carried on more major news networks here in the future as we get a decision. But currently, right now, it's going to court. They're arguing on it, so I wish them the best of luck. All right, let's see what else I got here. This is kind of an interesting article. I think we missed this one back this fall, but I wanted to bring it back because we've been talking a lot about CBD. It's one of the cannabinoids that's available there. It's one of the ones that a lot of people are referring to in the news and the media, but it's also because it's extremely effective medicinally. And one of the questions I think that was asked or can be brought up is, can you actually vaporize CBD? You think about it. Well, you go ahead and vaporize cannabis or smoke it, and what do you get out of it? We know that through decarboxylation, we're changing the cannabinoids presently from the flowered form or whatever form it may be in when you're smoking it to another form of THC. So we know that the THC goes through a transformation, but what's going on with the CBD, the medicinal part of that medication, and they did a study on it. So it's kind of cool. University of, I'm going to get this one wrong, but it's Wollongong in Australia. Did a study on it and basically found out that through vaporization, you do transfer CBD. It does come through, and it is effective. So that's good news. I mean, for you folks out there that do like to smoke or vaporize your cannabis, you can rest assured that you will receive the medication that's available there when you're ingesting in that method. So, of course, want to bring up the more effective ingestion method is eating it, through some type of edible or sublingual. Like if you have some sort of a tincture or a spray, something that can soak in through your mouth. But at any rate, if you're going to smoke it, you can get it, and of course you can get it by using those other methods as well. So good stuff, and I think it's important that that stuff's kind of studied. So congratulations to the University of Wollongong. Man, I wish I knew those Australian words. Wollongong. Wollongong.
Yeah, they got some weird names on there. It's like, I think they should, like I don't know if you've ever seen the Welsh too. They have some weird names too. Like they got like 2 L spelling of names, and
Did you say Welsh?
Welsh, yeah, Welsh names. So, I mean, and then they have like a lot of that goes over.
Smoke my cannabis.
But they got all those Aboriginal names are just bizarre, by way our understanding of speaking.
GBD. Yeah, something like that.
Yeah.
Crazy. All right, that's basically what I got for you this week. I was just blown away by the Alien OG. That's awesome. Those results are fantastic. I want to taste it. You know what I'm saying? And that's about it. I mean, it's kind of slow right now, thankfully, with not a whole lot of legislation going on like we were talking about, so not a whole lot in that area. But, I think it's something that we should have an impact on. So just a friendly reminder to get involved as best you can. And in the meantime, try to stay warm, stay safe, take care of your garden, and we'll catch you here next week. All right? Thanks for joining me on the podcast this week. You guys rock. Keep it smoky. We'll see you here next week. Bye.